Hey guys, thanks for tuning into What the What with your girl Tina. Today we are in Selma, Texas at Optique Eye Care. We're going to talk about the most important thing on your body, which is your eyes. Something you guys use every single day. Dr. Ken Kikuchi is going to answer all of our questions today. I hope you guys enjoy today's interview. Thank you, Dr. Ken Kikuchi, for joining us on What the What today. I hope you guys are super excited to talk about your eyes. So what we really want to talk about today, Dr. Ken, is why is it so important for people to get your basic eye exam?
Yeah, so basically, getting an eye exam will allow us to find out if somebody's having any kind of vision problems, they're not able to see far away, up close, computer screens. So that's the basic of what a routine eye exam would assess. But even further, it can also assess if there's any kind of problems with the health of the eye. So if you have bad allergies, dry eye issues, I get headaches from staring at a computer screen for too long or watching TV. That is something that we can take a look at and see if there's any issues going on. Also, if you have any kind of an issue in your body, such as diabetes, blood pressure issues, cholesterol issues, thyroid issues, a lot of rheumatoid arthritis, all these conditions, a lot of times it can affect the eyes. Even treatment for these medications can also affect the eyes as well. So it's very important to get those eyes checked once a year to try to roll those issues out. And if there is anything serious, we need to assess it because a lot of the consequences can be very severe.
And that is very important, seeing as how we use them every single day. So how long would you say a normal eye exam would take?
Generally about 30 minutes for a nice, good, thorough eye exam. So basically, we would assess the vision, then we would check on the prescription of the eyes to make sure that, find out the state of the basically nearsightedness, farsightedness, and whatnot. And then after that, we would assess the health of the eyes. And then from there, if we want to get dilated or we choose to dilate the eyes, that can take additional about 15 minutes or so. And then after that, say a patient wants to go in and do, before that, contact lens fitting, typically can take a little bit longer than that too. And upon examining the eyes, after they're dilated or not dilated, then we kind of talk about the plan, the assessment of the plan, and figure out what kind of glasses they would benefit from, what kind of contact lenses they would benefit from, and if there is any kind of a medical condition, we like to assess that and talk about it in detail so we can come up with a plan.
Oh, fantastic. So you guys probably didn't know that you could just do that with one single optometrist appointment. That is a very, very good thing to do and something that you guys use every single day. So what is the point of dilating your eyes? I've had my eyes dilated and I know that my eyes get super sensitive, especially afterwards.
Yes, it's not the most fun thing to do, but it is extremely important because once you dilate the eyes, us eye doctors are able to assess the back of the eye really thoroughly. We're able to see structures that we're not usually able to see when we're not dilated. So we like to assess the retina, which is the film in the back of the eye, which is a very important structure in the eye. So the film, if there's a problem with the film in the back of the eye, it is something that could be extremely serious. And by dilation, we can take a look in the really, really periphery of the eyes to figure out if there's a tear or a hole. And also, if there's any kind of, sometimes we can also see like a tumor or a little growth in the back of the eye, which can be very serious. And also, if there's any kind of an issue with the blood vessels, if there's any hemorrhaging from bad diabetes, blood pressure, whatnot, sometimes we can miss that if we don't dilate.
Oh my goodness, that is very scary stuff. I didn't know you could actually see tumors in that. That's crazy.
Yes.
So I've had friends that ask me, especially who are getting pregnant or who have been pregnant, they actually have changes in their eyes. So why is that though?
Yes, so that's a very good question because a lot of times it's due to hormonal changes. So there's a lot of water retention that starts to occur on the parts of the eyes. So the cornea, the front of the eye, and something called a crystalline lens inside the eye tends to change. The shape of it can change, the curvature can change, and that can induce a little bit of blur and some fluctuations in vision. Sometimes blood sugar changes can also be experienced during pregnancy. It's called gestational diabetes. And then that can also cause fluctuations in your vision as well.
Wow. So how long would you say after giving birth should a woman wait to get their eye exam again?
I usually tell them about a month. Now, I have seen patients that come in during all trimesters, and majority of patients, they do pretty well, and the prescriptions generally don't change, but I have also seen the other spectrum too, when the prescription can change drastically, and it could be intermittent or it could be permanent afterwards, but to be on the safe side, I would say maybe about a month.
Okay. So I do see about the glaucoma specialist. Now, can you explain what is glaucoma and what are the early signs of glaucoma? What should we look out for?
Yes, so a lot of people know and hear about glaucoma, and it is a very serious issue. Now, the scary thing about glaucoma is a lot of patients, they don't know that they have glaucoma because it doesn't really cause any symptoms in your vision. Because glaucoma is a condition that affects your peripheral vision initially, so that's not something that we can really gauge just by looking at an eye chart.
So it
or
wouldn't
doing
be
general
like
test.
a vision loss, and that's how you know you have
Correct.
glaucoma.
Not the central vision, but it affects your peripheral vision in the beginning. And there are certain tests that can detect that. And also, what's very important is the pressure inside the eye. So we measure that during the routine eye exam as well. And we also look at the back of the eye to check on the optic nerve. So the optic nerve is basically the cable wire that connects the eyeball to the brain. And certain appearances of the optic nerve can show damage. And when we see that damage, then we have to act accordingly, or else it can get worse, and then you can start to lose that peripheral vision further, and in real severe cases, it can even affect your central vision as well. And a lot of people, in these real severe cases of glaucoma, they'll end up with something called tunnel vision, where they have nothing but the central portion of your vision, and then, basically, they'll cause a lot of problems. Driving is one of the biggest issues when you can't see, and, they won't be able to see anything on the periphery and bump into walls and bump into people, and that can obviously be a problem. Yes.
I would say I have tunnel vision sometimes, but that's not due to glaucoma. So another thing that I guess we could talk about is how do you prevent further vision loss? What are the things that our fans and viewers can actually do to prevent further vision loss or to prevent their eyes from getting worse than they already are?
Yeah, so as we discussed earlier, getting a routine eye exam, getting your eyes checked at least once a year is essential. So, like I said, there's a lot of conditions that you just don't know that you even have until you have an eye exam. And not only just for vision, but your health too, as I discussed earlier. So I have discussed people, I've actually discovered people with diabetes, uncontrolled blood sugars, blood pressure. I even discovered people with brain tumors in the past by just getting a routine eye exam.
And this is all in the eyes. This is amazing how everything is just so connected, you guys. We don't even think about these things. These things are just, we use these every single day. We're not thinking about the health. We think about, like our tummy hurts, we need to go to the doctor, but your eyes, tumors, guys. Seriously. So it is very important for people to get their routine eye exam. And would you say the majority of insurances would help cover the routine eye exams if you have eye care coverage?
Yes, so there are a lot of vision plans available that will cover for a routine eye exam with a very small amount of copay. And believe it or not, even some medical insurances can actually cover for routine eye exam. So even if you don't have a vision plan, it's always good to take a look at your medical insurance and see if that has any kind of coverage on the routine eye exam as well.
Fantastic. And also when it comes to contacts, I know that sometimes I love to wear contacts, but there are certain contacts that are drier than others or better for you than others. What would you say is an important care when it comes to putting your fingers into your eyes?
Yes, so just like anything, general hygiene is extremely important. So washing your hands really well before we're dealing with contact lenses, whether you're putting them in, taking them off, even rubbing your eyes, it's always good to make sure you take everything off of your fingers as much as possible. And also, what also reflects the health of the eye is how often you wear your contacts too. So if you're wearing it every day, you're wearing it over 10 hours a day, it is going to cause a lot of stress to the eyes. It will also cause a lot of dryness, and the lenses will start to irritate your eyes, cause a little watery eyes, redness, and that's basically your eye telling you to take the contacts off and let your eyes rest. So other things that people do, which is not a good habit, is sleeping in your contacts.
Yeah.
Big no-no. Yes, so sleeping in contact lenses actually allow the cornea, the front of the eye, to get deprived of oxygen. So when the oxygen goes away, your eyes become more prone to changes, fluctuations in visions, and worst case scenario, you can get a really serious infection in your eyes from bacteria and virus, fungus, parasites. I've seen it all. So it's very, very serious consequences can occur when that happens.
Yeah, exactly. And bacteria in your eye, you guys, is no joke. I know, I've had it. It's bad. It's itchy, it's irritating, and it just, you can't do anything about it. You can't take your eyes out. So it's really irritating altogether. I'm so glad we get to talk about all the basics of getting your routine eye exam today. These are probably things that you guys don't ever think about when you go to your optometrist. You guys should always write down questions so you know what to ask. Now, Dr. Ken, was there anything else you would like to add for our viewers to know that what is so important about your eyes?
Basically what I mentioned, yeah. So yes, just once a year, and again, getting and especially with the patients who wear contact lenses, it's just become a big problem. There are people out there just overwear their contact lenses more than they should, and it's always good to have a backup pair of glasses. So not a lot of people wear contacts because they don't want to wear glasses, but it's always good to have a pair of glasses on the side. Another very important thing is UV protection. Outdoors, when you're outside, a lot of people, they don't wear sunglasses, or they don't wear sunglasses that have very good UV protection, ultraviolet protection, and that can cause a lot of issues with your eyes as well. So too much sun, just like your skin, yes, you don't want too much of that getting into your eyes, because that can cause a lot of problems in the eyes as well. And another thing that's also very a big issue is we're just using a lot of computers, tablets, phones. So staring at a phone, computers,
stresses
your eyes considerably. And there is something called blue light that gets emitted from these screens that can cause a lot of eye strain, migraines, sleep disorders even. So that's another aspect that we try to help out with patients with different options that we can put on the glasses. And a lot of kind of lifestyle changes that can help with that as well.
And speaking of the blue light that I've noticed, I actually did have this question asked me. I have a girlfriend who has a little child who, when he is on the iPad too much, it's like he has nightmares or he can't sleep as much. Is it due to all the stimulation that is due to like the eyes and being on the iPad and everything? Is it good for them to be on it all the time?
We always say, everything is good to moderation. So exactly. I think having iPads and tablets, even whether it's a child, adult, it's always good to basically keep an eye on the time. Too much exposure to those blue light can definitely cause all kinds of issues, and
affect your eyes.
Always, yes, exactly. So even if it's just reading books, but especially for things like tablets and computers and phones, you don't want to be so glued to this. And also, there's also just when children stare at those screens for such a long period of time, their eyes can also change, and eyes can become more nearsighted, and then they're going to have to get stronger glasses over time. So again, moderation is key.
Yeah, these are the things that we don't think about. These are the things that we don't ask questions about. I'm so glad you are here today, Uncle Dr. Ken, to actually answer all of our questions. And by the way, yes, guys, I slipped. He is my uncle, and this is a fantastic, fantastic place to get your eyes examined. He is very knowledgeable, will tell you everything. And look at the selection of glasses. And you have a huge selection of contacts as well.
Yes, we do. Yes, up to the highest technology. So we have all kinds of contact lenses that have very good oxygen. We spoke earlier about getting oxygen to your eyes. We even have daily disposable contacts, which are wonderful for people who have real severe dry eyes, bad allergies, or they just don't want to deal with cases and solutions. People who get like recurrent infections, those are great options as well. We even do very specialized hard contact lenses for people who have a very difficult curvature issues in the cornea, the front of the eye. And as far as contacts for patients who can't see up close after your 40s, we have multifocal contacts, which have been a great success in our practice as well. And of course, a lot of the contact lenses nowadays, even astigmatism correction for curvature, there's a lot of options for that too. We have great success with fitting a lot of my patients with this the latest technology.
And that is fantastic. fantastic. So you guys, I will add the website into the comment box. Don't forget, all the handles will be in the comment box. I appreciate you guys for being here with us today. I appreciate Dr. Ken for answering all of our basic questions today. You guys, don't forget to check out Optique Eye Care in Selma, Texas. I will post the address, website, phone number, and everything. You guys make sure you get your eye exam checked. You need it. It is very important. You use these things every single day. Thank you, Dr. Ken, so much for joining What the What today.
Thank you for having me.